Good morning and welcome to this latest episode of FitWitMD Live. We have a special program to you highlighting dietary management in Crohn's and colitis with a South Asian diet. So if you're from South Asia, anywhere in the world, we hope you're tuning in and finding this program helpful. We've got a great program ahead of us. We can't wait to get started. Welcome again. So we have a tremendous lineup here. We are going to be having Dr. Sumit Bhatia from India joining us, gastroenterologist, and we're going to be talking dietary guidance actually with Neha Shah, who's a registered dietitian. She has a million credentials and is going to be joining us. And then also the wonderful expertise of course, Own Your Crohn's, Tina. So welcome everybody this morning. How's everybody doing?
Hi, happy Friday.
Happy Friday.
Good to see everyone.
Hi,
So we
Dr.
are
Nandi.
across
Thank
four
you for
different time
inviting me.
zones today, and we have a lot of information to get to. I want to say special thanks to our guests, Dr. Bhatia, Tina, Neha for coming today and giving us some highlights of some of the guidelines for South Asians who are living with Crohn's and colitis and how they can make the most out of their diet. So without further ado, we're going to get to the slides here. You can follow any of our guests online on social media. Everyone has a tremendous presence on Twitter and also on Facebook and Instagram. But you can find even more highlights and connect with us there if you want more information. So first off, I want to ask, Dr. Bhatia, what is the real role of diet in IBD? Dr. Bhatia, we have so many patients who are looking to heal themselves from within with natural therapies. And who wouldn't want that, of course? But I'm hoping you can give us the highlights of what are the limitations, what are the abilities of using diet to heal our inflammatory bowel disease. What do we know?
Thank you, Dr. Nandi. Thank you, Tina and Neha, for having me here today. It's a very important and very the most neglected aspect of IBD treatment here. So, inflammatory bowel disease treatment, we know that the diet has definite role in IBD. All of us have this very firm belief that pathogenesis or the onset of inflammatory bowel disease happens with the dietary intake. And the evidence actually comes from large scale epidemiological studies wherein populations have been studied, which saw that with the more adoption of Western kind of lifestyle and the Western kind of diet, when that happens over a period of time, the incidence of IBD actually goes up. So that's what we have been noticing in our country, in India right now, and even in South Asia, that the incidence of IBD, which was way below the normal levels 2 decades back. In the last 2 decades, we are almost about to become the IBD capital of the world. So that has been always been implicated due to adoption of complete Western diet, which is low in fruits and vegetables, low in roughage, low in fiber, more processed food and more processed meat, and more consumption of red meat, increased usage of alcohol and smoking, and these have always been postulated to be the pathogenesis of Crohn's and ulcerative colitis. And also it was always seen that the people who have migrated from India down to US, to Europe, the subsequent generations actually had an incidence rate of developing IBD as per their new environment rather than from their native countries. So this lifestyle, and diet is a major part of lifestyle, has always been intriguing to see that it is a major factor. Now, having said that, the evidence actually is only limited to epidemiological studies. If we actually go in to look at the evidence to say one particular food or one particular type of diet, whether it causes IBD, we still don't have good evidence to say that. So we have to remember that yes, environmental factors are only maybe a part of the pathogenesis pathway in IBD, and it is not the actually the entire story. So coming back to your question, Dr. Nandi, which you asked very specifically, can we heal ourselves from within? So my take on that will be yes, we can heal, but only to a certain extent. Diet cannot replace the standard medical therapy, which unfortunately if a patient develops IBD, he has to undergo. But yes, diet and environmental factors, to a very large extent can modify the symptoms and allow the disease to heal by itself, allow the body to heal, especially for the patients who just suffer from this debilitating disease. So it's an important factor in making them comfortable and making them recover faster. But it cannot be, a means to an end to say that, the diet will replace. But um, most of my patients actually ask only this question,
Yeah.
and they somehow try to blame themselves for eating something bad, and that's why they have gotten a flare. And that's a myth which I would like Neha and Tina to, just break today, that it is
Yes.
not because they have done something wrong that they have gotten a flare. Please understand that. So though we know a lot of things about the pathogenesis of IBD, we're still not having, absolute clarity to say that, please don't eat this, or to be too restrictive with our diets.
And I think those are great points. And I want to use that last thought to transition into diet more. But just to kind of recap some of what you said, and for our viewers out there, we know that environmental factors that are not genetic make up the bulk of what causes inflammatory bowel disease. And there are millions of
Yes.
environmental
Yes.
factors, one of them being diet, which is to some degree modifiable. And when we look at
Yes.
studies, association studies, that you're at increased risk for developing IBD, okay, not necessarily causing, but it's a lot of strong associations with diets that are higher in
Associations.
red
Yes.
meats or processed foods. And then
Absolutely.
the other part is dietary constituents like emulsifiers that Dr. Bhatia mentioned, which you would think a Twinkie, which is an American baked pastry that does not decay after 5 centuries because it has preservatives. I'm
Right.
probably going to get sued. So it does not decay. It's not. You would think it's harmless, but it may actually disrupt the microbiome and perhaps have an influence. Now, there's a lot of may, there's a lot of perhaps, but there's enough data stacking up to have
Exactly.
us have the confidence to tell you you can have some of that good stuff, some of those things in very minimal moderation, but try to eat foods that are more natural, less processed. Try to avoid red meat or minimize it. And just a thought, there's been longitudinal studies 30 years ago and modern day showing increased prevalence of IBD, particularly in areas of India where there's been more infiltration of that Western diet. Um, so with that, I want to go to our next question, and this is well, you kind of touched on this. Can diet actually replace treatment? Look at all these diets that we have, right? We've got Mediterranean diet, paleo, keto, low FODMAP. I don't know why it's listed twice. Specific carbohydrate diet. What's everyone's take on this? What is the limit or capability of these diets?
Well, let me start off by saying there's more diets than what you just listed. I actually counted it yesterday. There are 12 diets out there proposed for IBD. And no wonder so many have questions on which diet to follow because there's so many diets out there. Each of the diets, certainly have their own guidelines on what to avoid and what to eat more of. But they're all different from one to another. So this also shows that although some diets can make one feel better with their symptoms, it does not mean that the inflammation has gone down. And certainly with the use of diet, I always been supportive of my patients if they want to try diet as a therapy, but it should not replace medical therapy. And my concern there is that if one chooses to use diet to replace medical therapy, then the question is, are we increasing the risk of complications? Or if the treatment options that were offered at that one moment in time, if that individual wants to explore medical therapy again, will those same treatment options still be available, or would it be appropriate? It is so important to treat IBD as soon as possible to really reduce the risk of complications and really to reduce the risk of malnutrition developing, which can also increase complications. So, and with all the diets out there, like I said, there are 12 diets out there. They have their own guidelines. A common theme between all those diets out there is that it involves some guidelines on what fruits and vegetables and legumes to eat more of and less of. And then certainly some diets, recommend don't eat any grains, and then some diets recommend eating certain grains. So it's really, again, how do we make this more feasible if one were to try to diet to reduce the risk of malnutrition and supportive of medical therapy. And certainly, if any signs of malnutrition that comes up, which we'll talk about soon, then we need to take a step back and really look at, is this particular approach appropriate or not?
Yeah, 100%. Tina, what has your been experience as a patient and the diets
Yes,
that
I want.
you may have tried or heard other patients try?
So to be honest with you, this was a real pressure when I was first diagnosed as, oh, you have to change your diet. Completely understand. But there was this real pressure, like in the sense that like it was like, oh, Tina, you must have eaten a lot of garbage or, drank too much or did this to yourself. But I was just being a normal 22-year-old kid. So I didn't really feel like I did anything that warranted such extensive disease. But there is this factor of blaming ourselves, like Dr. Bhatia was talking about, and I don't think that's being fair to ourselves or true to ourselves. I think many of us do try very hard to maintain a good diet, a well balanced diet. I know I certainly do. So I think we need to move away from that blaming and shaming culture. And what, other people might be telling us is something we have to distance ourselves from and really tell ourselves, look at what it is that we're doing. If you feel like your diet is generally healthy, I think that's a good baseline. I know I try my best.
Yes.
There's certain things that trigger me. I did try a bunch of these diets. One of which led me into the ER, with dehydration and malnutrition. So I think we have to be really careful. We have to work very closely with the GI dietitian like Neha. We have to work very closely with our GI physicians like Dr. Bhatia and Dr. Nandi. And that, there is this fine balance between, hearing what our families and society has to say versus what our doctors and dietitians have to say. So
Exactly.
I always tell patients to be very cautious with their diets and over restricting their diets, because diets are a part of our mental health. And I think having the ability to eat more things really helps us feel better about ourselves. So I really don't believe in overly restrictive diets. I think there are ways to reintroduce foods, and I think that's a little bit of what we'll be talking about today. So I'm excited to continue this conversation.
Yeah.
Yeah, 100%. 100%. So,
And then one thing I can also quickly add. Oh, so sorry.
no, go for it, please.
So it's really a message to all the different camps or parties involved. Like my message to all the patients out there, if you're interested in learning more about diet, definitely, work with your medical team and, ask for a referral to see a dietitian to help get your questions answered and to really discuss the risk and benefits. And it's also a message to all the healthcare providers out there. If patients come to you asking questions about diet, be open and discuss the questions. Be open to their willingness to try the diet therapy based on risk and benefits. And again, referring the patient to the dietitian. And certainly is also a message to the caregivers is that there's a lot of information out there about diet. How one responds to diet is really it's so varied from one person to another. So certainly just keep an open mind of how diet can be used versus comparing how diet helped this one person and it can help you, and just really be open to the conversation that diet can bring forward.
Great
Yeah.
point, Neha.
Yeah, I think that's
Yes.
sound advice. So, Dr. Bhatia opened us up by talking about, the role of diet, the extent of diet to influence us. We learned about some of the things that may be associated with causing IBD. Treating IBD with diet is a bit more challenging. That data is evolving. And we talked about some of these fad diets, what's going to work. Everyone's different. And yes, if you're a patient, find a dietitian. They're so
Yes.
well trained. This is what they know. This is what they do. They can customize and learn you and help you. And make sure you get the right nutrients. And then if you're a doc or you're a clinician watching this, I hope, depending on where you are, there's usually a national society for dietitians, and you can refer to them. So if you don't know what to say, that's okay. Unfortunately, they don't teach us all that, at least as a GI.
Yeah.
So use your dietitian. There's always a way. I want to talk about, how do we know if we are becoming malnourished, right? So, you may not know as a patient that you're becoming malnourished even until a family member, shares that with you, right? So, Neha, I'm hoping, can you tell us a little bit about what leads to malnourishment, and how does one even know that you're actually malnourished? What if you're not? It's such a slow process you don't even recognize it.
Absolutely. So, the main cause, there's several causes to malnutrition. Certainly, the main cause of malnutrition is, certainly eating less, but the inflammation related to IBD can also contribute to malnutrition. Either the inflammation causes, symptoms that leads to someone eating less, restrictive diets, taking out so many of the food groups. And in turn, we don't have the nutrients to nourish ourselves during the process of this inflammation. And certainly there's that fear of eating, you're walking on eggshells around your diet. It's just easier not to do that. And then certainly eating less, possible malabsorption for inflammation, just taking out so many of the food groups that can nourish ourselves can lead to weight loss, a loss of muscle mass, which we term as sarcopenia. And certainly malabsorption kind of leads to, you know, um, a loss of nutrients from the body. Diarrhea can certainly is an example of that. And certainly there are side effects from medications that can also lead to malabsorption of certain nutrients as well. So there's multiple causes of malnutrition. And the thing with malnutrition is that once it starts to develop, it really requires treatment to avoid complications from malnutrition, which includes hospitalizations or looking at other forms of nutrition to help you stay nourished. And then certainly with malnutrition, from my experience, again, an example I can throw out there, if one is requiring surgery for their inflammatory bowel disease, it can actually delay surgery because we have to correct that malnutrition. So, same thing with IBD. We want to treat it early on. If we start to see signs of malnutrition coming up, then we want to treat it as soon as possible so we can, get you on the path of nourishment.
Yeah, no, that totally makes sense. I think, couple things on this slide you highlighted, right, are, many things about how much dietary intake you take in, anabolic. If you can't build anything if you don't take in enough nutrition. If you're having a flare, or you have a wound, or you're healing post-operatively, you may in a catabolic state, you're breaking down nutrition. And then the other factors of dehydration and all sorts of things. But there's many things that can lead to it. You just may not realize it. So you can ask your clinician if they feel that you're malnourished and need nutritional supplementation. Tina, can you talk a little bit more about your experiences, as a patient?
Yeah, absolutely. So, I was, as I mentioned earlier, I was getting a lot of pressure from family saying this is a diet disease. I want to be very clear here. Inflammatory bowel disease, as the doctors were saying, one of the many, many, many sort of environmental factors is diet, right? So I don't think we can really take that pressure on so much. And I was very young, so I did. I was 60 kgs, just to give you perspective, at the end of 2007. When I entered this flare-up, I was 38 kgs going into surgery. I was being fed by a PICC line in my arm that was giving me nutrition. And I understand that some of these forms of enteral or parenteral nutrition can be very stigmatized, especially in our culture. But this is what allowed me to go into surgery. I was on that nutrition, that parenteral nutrition, for 2 months prior to surgery and 2 months after surgery. I want to also emphasize the role of, using some of these enteral, parenteral nutrition to help make sure that we can build our bodies up and rebuild our bodies after massive flares or after surgery, but also the role of using things like smoothies, which is something that I do on a daily basis. And I think we're going to talk about that a little bit more, how to get that nutrition but to do it in a way that our body can digest, that's sort of pre-digested. So I'm curious actually to hear your thoughts, Dr. Bhatia, about malnutrition and sort of what you're seeing in India, and what your hopes are in terms of making sure your patients have, that supplemental nutrition.
Okay. Uh, Thank you for asking that, Tina. So, if some clinicians are tuned in, and I would like to hear Dr. Nandi's thoughts after this. When a patient comes to me in my clinic, I do a very quick malnutrition assessment. I'm not an expert to assess that, but there are certain things which I look for. So one is definitely how much of weight they have gained, or how much of weight they have lost. So if there is a frank weight loss with symptoms, obviously, that's a clear-cut indicator of malnutrition. Second thing is a serum albumin. That's an important marker for us to assess, quickly in a busy clinic, to see whether there is malnutrition. And I do a simple thing called a hand grip test to look for sarcopenia, which has been shown to be, the loss of muscle mass has been shown to be associated with the poor outcomes. Um, I also generally check for micronutrients, especially iron, and I have seen it in my practice that a decrease in serum iron concentration generally is associated with a flare. So I'm very particular to screen my patients for B12 deficiencies and iron deficiencies, and hypoproteinemia. So those are the things I quickly actually look for. Coming to dietary advice, I'm very liberal physician, so I absolutely don't ask my patients to be restrictive at all, except in the situation of stricturing Crohn's disease, wherein I tell my patients to go off fiber for some time. And fiber may be very different in American culture and in Indian culture,
Yeah.
because Indian diet, majority of my patients are vegetarians, and
Yes.
most of the diet is vegetable based. So to tell them, so the specific questions will be there, like which vegetables and which fruits. So if the patient is predominantly vegetarian, yes, at that point of time, if they have a symptomatic stricturing disease, the diet becomes restrictive. But that's the only situation wherein I generally use a restrictive diet. But otherwise, I'm all for taking a balanced diet in an IBD patient. And the second thing, whatever diets were displayed on there, the only medical evidence to say that any diet works is something called as an exclusive enteral nutrition. And there has been significant and good amount of data to say that exclusive enteral nutrition, when specially used in the pediatric population, has been shown to induce remission in Crohn's disease. So there is good evidence in pediatric population by using exclusive enteral nutrition to induce remission, and it has been compared with steroids. So um, um, that's a great point there, that a dietary therapy can induce remission. But then again, it's very difficult. Neha may be able to tell us more in detail. It's very difficult to practice practically for a patient to go on an exclusive enteral nutrition diet.
Yeah.
That's a little technical stuff. But then coming back to the last point, which Tina said, that parenteral nutrition, it has been stigmatized. Even exclusive enteral nutrition is to a very large extent stigmatized, because it requires a feeding tube. So in Indian culture, especially when there is a feeding tube, I have family members who just come look at the patient and they just start crying, assuming that they are extremely sick and they're going to die. But then they don't realize that that feeding tube is the one which actually helps them to recover really fast, rather than having no nutrition at all. And parenteral nutrition, I generally use in my perioperative patients who are too sick, but they require a surgery. So we use it prior to surgery, during surgery, and after surgery, so that the patients don't go in for a complete nutritional deficiency. Without nutrition, the tissues, I tell my patients, they are like wet blotting paper. So your intestines are like wet blotting paper. If you don't have any albumin, it's just going to give way. So we have to have nutrition. Okay.
Yes.
Absolutely. Can you tell us a little bit about what serum albumin is? I don't think there's enough focus on this in our culture. In American culture, there's a huge focus on albumin. And I remember my levels being like 0.6, 0.7, and that's really
Yeah.
considered very low. So if one of you can please talk about serum albumin and
Yeah.
what that means for malnourishment.
Yeah. I can certainly
Dr. Nandi?
elaborate on that. So, serum albumin levels, it is what we call a visceral protein marker in our blood. And traditionally, it's been reflective of nutritional status. But what we're learning more and more is what we call it as a negative acute phase reactant. So, meaning when there is a significant amount of inflammation in our body, or if our body's recovering from surgery, our body is going to make less albumin. So, for one, when I see a low albumin and then there is signs of active flare, then I am highly suspecting that albumin level is related to the inflammation, and it may not go up until the inflammation comes down. But how I use it as a nutritional marker is lower the albumin, likely the my that my patient is really ill. As you know, when I
Yeah.
look at that low albumin in context of everything else that's going on around them. So, and I find a lot of my patients with really low albumin, significant malnutrition, significant inflammation, they're already not eating as well to stay nourished. So that's how I use albumin to help me understand what is the depth and the significance what's going on with an IBD. But it takes some time for the albumin levels to come up. It takes about 21 days for it to come up because and then we have a large amount of albumin in our body. So I don't rely on albumin per se, like, oh, is it going up yet? Because it's going to take a very long time for that lab to come up. But I use it as a way to help me understand what is going on here, and let me see how I can intervene to help this person stay nourished.
Yeah. I think we have.
Absolutely right, and that's a good inflammatory marker, right?
Yes.
One of the
Yeah,
excellent
I
inflammatory
agree.
markers.
Yeah,
Yes.
and just to be clear for our audience, we talk about these biomarkers like albumin. It's not one marker; it's a global assessment, of the patient
Yes.
that's most accurate.
Yes.
And that's what we have to look at, right? So, if you think your albumin's normal numerically, but you have muscle wasting in your temples and you can see your clavicles and bones a little bit too much, you're malnourished to some degree. So, it's the whole picture, taking the labs, the physical exam together. Now, Dr. Bhatia already answered some of this on our next slide, which is, when we get malnourished, what types of nutrition are we at risk for to become malnourished with? And so earlier it was already mentioned that some vital nutrients are absorbed during different parts of
Yeah.
the intestinal segment. And so some of these, and just to be mindful of our time and our audience's time, we mentioned iron. We can lose iron through obvious blood loss, such as an ulcerative colitis. But did you know that the actual state of inflammation in Crohn's, very rarely do you see a lot of blood, but even in Crohn's, that's the state of inflammation prevents hormones in the body from absorbing iron from your gut.
Yeah.
If you've had small bowel resections, particularly of the end of your bowel, you may not absorb B12 or folate. In the United States, our diet is actually supplemented, our grains, our cereals, with extra folate to prevent deficiency, but that's not done everywhere. And so you have to be mindful, especially if you've had surgical resection or if you're on medicines like methotrexate, which actually physically, biochemically depletes you of folate. So you should be taking folic acid 1 milligram a day. And then, of course, steroids. Steroids such as prednisone, prednisolone, methylprednisolone, you may get these orally, you may get them intravenously, can also cause significant resorption of bone and lead to osteopenia or osteoporosis. This means weakened bone density. You may have low weakened bone density because of your inflammation in your gut. You may not absorb or intake as much calcium or vitamin D, which is used to make bones. And then, of course, other things that are vital, such as zinc and magnesium. These are elements, are metals that are necessary for wound healing. White blood cells, special ones, matrix metalloproteinases, they utilize these to actually create healing. And so sometimes zinc deficiency can actually present with diarrhea. So that's an underdiagnosed deficiency that can manifest with diarrhea that even most places may not be thinking to look for. So with that in mind, I do want to move to the next slide. And this is where we're kind of getting to the meat of things. Haha,
Yes.
pun intended.
Yes.
How, the funny thing is I've become vegan, so I don't eat meat anymore. But
Yeah, I'm plant-based for the most part too, with some dairy.
there you go. And also, our audience has asked several questions, and I want you
Yes.
to know that we're going to answer these questions kind of rapid fire before the hour is over. But I do want to get to some of the suggestions, right? Practical suggestions, but how can you introduce more protein and more fiber in your diet? And so, Neha, I'm going to leave it to you. If you can kind of
Okay.
talk us through this slide and give us some concrete suggestions.
Okay. So a couple of things with protein is that, one aspect with protein is that we want to make sure that we include it at every single meal that you eat. Now, being, many South Asians, including myself, I'm a vegetarian. I don't eat eggs very often, and I may have a dairy once or twice in the day, but majority of my protein is coming from plant-based proteins such as dal and rajma and nuts and quinoa and so forth. So a lot of my patients who are vegetarian or vegan, they're told to cut back on their fiber. So what happens? They cut back on all the protein that they usually eat. So now their diet is very low in protein and becomes very high in carbohydrates and fats to make up for the calories. So with that said, just to give you some practical suggestions within the South Asian diet, our South Asian foods, your dal, your rajma, even something like quinoa or tofu, masala tofu or tofu burji are perfectly okay to eat. I think we have to look at ways how we can cook it and eat it in portions that you can handle to help you bring in that protein. Common recommendations that I will give my patients, like for something like upma, okay, it's a common food eaten in the morning, but if you're gluten-free, you can make it from oats or millet, or you can sprinkle quinoa into that upma to make it a higher protein upma. Or I really like quinoa because it doesn't have much of a taste to it, but you can sprinkle it into soups and into rice, into again upma, sambar and dal and so forth. Even if it's like your two thumbs put together, which is roughly a tablespoon, a little bit can also help you build some trust with those fiber containing foods in amounts that you can handle.
Neha, I
Dal
have
is
to.
usually pretty blended, and yes.
I know. I wanted to say, what you just said there, and you have it on your slide too. But that was such a great point, which is add just a little bit, just to learn to trust it.
Yes.
And part of something which is still a relatively new concept for myself to have learned is this concept that you all are very well versed with: avoidant restrictive intake food disorder. And
Yes.
it's not an eating disorder, it's not a body image disorder, it's just you learn to have an aversion to certain foods. And you may avoid those foods because it causes you some type of cramp or discomfort or symptom.
Yes.
So what Neha just said for everybody out there is really important. If there's a food that affects you, especially if it's like a
A
grain or a
tablespoon.
plant-based food,
Yes.
tablespoon,
Yes.
learn to trust it.
Yes. Yes. So with that it said, when it comes to protein, even lactose-free buttermilk, if you're used to drinking chas, and then someone's telling you to avoid dairy altogether, you can try a little bit of lactose-free buttermilk to see if that would help you feel a little bit better. Or even, so with that said, and it's also tied in with fiber, because a lot of our plant-based protein is fiber. So my common strategy to help add protein and fiber is, can we pick one meal in the day, or even one meal 3 times a week, even if it's a tablespoon or two of that new food that you're trying, while you continue to eat the foods that you trust, can help you build up your diet again. And I've been very successful with that strategy to go from one meal, then to 2 meals, then to 3 meals. And I find that if I help my patients with strategies to build trust, it really opens that door to try more foods, especially when they're bringing me their own ideas of what to try. Then I know the wheels are turning.
Yeah, that's great. And
Neha, I
since you
have a
brought it
question
up,
for you.
no, I was going
No,
to ask a
sorry,
question about
Dr.
fiber and stricture, but you go first, Tina.
Yeah.
Okay, so I know you mentioned poha and upma. A lot of patients have, so this is a two-part question. So a lot of patients have questions like, okay, what vegetables would be okay to include in something like that, and how often should you reintroduce? Like, let's say I want to put some green beans in my upma or my poha. It, I'm used to potatoes, so I'm already putting those in. Let's say I want to put some green beans in. What do you suggest on how to do that? And then the second part of this question is, I know you mentioned lactose free or gluten free. Do IBD patients have to be lactose free and gluten free? So two-part
Those
question.
are two, yeah, those are two great questions. So my answer to adding, say, the cooked green beans or even cooked spinach to, any of those dishes is that one, a cooked version is better tolerated than a raw version, obviously. And then two is that the portions I tend to recommend, it could be a few tablespoons, which is really my two thumbs put together, or up to a size of a tennis ball, which is about a half a cup. And I really try to work with my patients to really understand what portions they're comfortable with, and then what vegetables they're comfortable with starting based on ideas I can provide and what they thought what they would like to try. And then in terms of frequency, what I would also recommend is, I try it again, it's really a partnership with my patients. I like to recommend at least 3 times a week. Like maybe Monday is your vegetable day. We'll try a cooked vegetable. Maybe Wednesday could be a peeled fruit day of some sort, whether it's blended into a smoothie or a lassi or a small amount on the side. Maybe Friday has another theme day. Okay. So, those are my response to that. And then with lactose free and gluten free, you don't need to be lactose free and gluten free, but I can certainly understand that symptoms can arise. And then it's really as tolerated, and we can work out those options.
So, I just wanted to say,
Yes.
we had a slide for that just to provide our viewers some concrete information. You can snap a photo on your phone and look at it. Some of the things that were described were trying to supplement your protein in between meals with a shake or ready-made options, ready-made shakes. You can easily build your own lassi and try it out. Don't unless you have very severe disease, work with a dietitian. Try to have whole foods or regular foods, but maybe you can use the protein shakes or lassi as a supplement between
Mm-hmm.
meals. And then Neha talked. Here's a couple of concrete suggestions. Can you quickly go over this beautiful, delicious recipe you just mentioned again, Neha?
Yeah. So with my patients, there's always a common question on, what smoothies I can try. And, smoothies is a loose term. It doesn't have to be sweet. It could be, savory as well. It could be a wide variety of ingredients. So, a 3-step part that I take with my patients is that step one, I'm recommending a smoothie or lassi to help provide liquid calories and liquid protein. And then step two is how much and how often. And then step three is what ideas can I provide that we can try. So this is an example of a lassi that I really enjoy. And avocado is a great source of healthy fats. Cucumber, you can peel it, it's a source of vegetable. Mint for a little bit of flavor. You can always throw in a little bit of fruit. I use a little bit of coconut water again to add a little bit of sweetness and flavor. And then, with lassis, buttermilk or plain yogurt can be used. And if one has an issue with dairy, it doesn't mean you have to avoid those. It just choose lactose free options to see if that would be helpful as well. So lassis, smoothies, it could be sweet or savory, but it's important to explore liquid calories and liquid protein to complement the diet and foods.
And that's really helpful. That there's natural things that we can find in our market that we can utilize. And then I know there's some other supplements that you listed here for us too that are really oral rehydration solutions for dehydration. Sometimes we use that
Yes.
for patients who have high ostomy output or just having massive diarrheal losses. Um, and then, Dr. Bhatia, I'd also be interested to know, what are other local options that our patients in South Asia, the continent itself, can also use.
Yeah. So buttermilk is a great option. Homemade cottage cheese are another good options.
Mm-hmm.
Um, just to add one point, as I told, most of my patients are vegetarian, and to have vegetarian sources of protein is actually a big challenge both for us and for the dietitian.
Yes.
So there are certain things which I'm not a dietitian, but I do suggest them to use what besan. So that is chickpea
Mm-hmm.
flour.
Mm-hmm.
I actually recommend them to use that more often, and soya bean. So my simple recommendations to them are they can use. There are some soya chunks available in our country, which is very freely available in even in the rural areas. So if the patient, they don't have the taste for soya, so I tell them to just boil it 100 grams of soya chunks or the the small powdery form, and add it to whatever diet they'll be taking through the day. So they can add it to their dal, their rice, their flour, or their regular wheat flour. They can get half a kg of soya or 1 kg of soya flour from the market and mix it, and then have rotis or pancakes made out of that. Then the besan chilas, which is very commonly taken in Indian diet. So the besan chilas, having a stuffing of some cottage cheese. So these are the common things which I generally tell my patients to just to change the taste, increase the protein content of their diet, um, because that's what they're looking for. They don't want Most of them don't want a monotonous diet, and at the same time they don't
Yes.
want to change from a vegetarian diet to a non-vegetarian diet and start taking eggs. So these are some simple
Non-veg.
solutions which and nuts, nuts, like Neha mentioned. So nuts is another good source of both calories, good fats, and proteins. So these are some simple solutions which I think everybody can practice. And then again,
Yeah.
the same message: don't be over restrictive. Just because you are eating something which tastes good does not give you a flair, and every flair is not a patient's mistake, and it is not because of diet.
Yeah,
And
absolutely. If I could
tolerance
just
can
add
vary from one person to another. Oh, go on. Yeah. Oh, I
well, no,
mentioned that tolerance to diet.
excellent
Yeah.
point. Both of you, excellent points. I think, we're not causing these flares, and our tolerance can vary, whether that's dairy, wheat, soya. Our tolerance can really vary. It's one of those things, like Dr. Nandi was saying, if you try a tablespoon of it, you'll get a sense, is this suiting me or not? So
Exactly.
you'll be able to see, is this
Exactly.
triggering me or not? Especially after a couple tries.
Absolutely. Yes.
Just to,
And that, on
put some
that
of
line,
Dr. Bhatia's
sorry, no, on that note, I'm
to
going to
put
show you
some
that
of Dr.
this
Bhatia's
table that
recommendations into context.
go for it, Tina. I think there's an audio lag. Go for it.
Sorry, I feel like okay. Just to put some of Dr. Bhatia's recommendations in context, some of the things that I do, I will take the soya chunks or the granules, and I'll put them in, an aloo matar sabji, or I'll add
Okay.
some green beans or
Yeah.
Yes.
cooked spinach in a gravy, and eat that. I'll make, even if besan's too heavy for you, I'll make the moong dal or the masoor dal chila, and
Yes.
I'll have some
Yes.
mint or coriander chutney homemade with that, so I'm getting some greens in there. And what I do with the chila is I also will throw in some vegetables like spinach, or you can throw in some tomatoes, some onions, you can throw in whatever suits you, and you can blend it up, and your body can, you'll be able to eat it because it's blended, and make a
Right.
pancake out of that. So those are some suggestions that I do.
Yeah.
So
And I
fabulous.
think
That's
those
what
are
I want
great
my patients
ideas.
to
I
use.
just wanted to
that's
show
that's
this
that's great
one
ideas.
table that Neha
Yeah.
actually developed for us, which looks at the amount of lactose
And this is
and
so useful.
vitamin D.
Yes.
And this is a helpful slide because, if you are lactose
Mm-hmm.
intolerant, which many South Asians are,
Yes.
and actually increases
Yes.
lactase enzyme to break down lactose decreases as we age. I don't think humans are not really meant to digest as much dairy as we do.
Yeah.
But if you are dairy
Yeah.
intolerant, then you may find that you may tolerate these different types of dairy formulations while still reaping the benefit of some protein and vitamin D and calcium in them as well. So I know we're about almost done with our hour. I really wanted us to get to some questions for our panel.
Yes.
Since we have everyone, it's rare to get so many experts in one virtual room, if you will. And our audience has asked some really great questions here. So I'm going to try to pop them up on the screen one by one in no particular order, okay? But one of our audience viewers asked just a quick question about, do we need to have a lot of protein because albumin feeding would go away in approximately 40 days? And I think what she's referencing is that if you give protein or give albumin infusion, IV, yes, it will not be the same. It will go away eventually. You have to have some type of permanent source.
Right. Right.
I wanted to get to a question here that someone was asking about here about fiber. So question was, and I'll read it out loud, how do I transition to a healthier diet with more fiber after recovering from a flare? I love fruits and vegetables, but high amounts per serving seem to give me issues, loose BMs, and eating has become something that she dislikes. We were talking about avoiding foods, right? So how can she go ahead and tolerate fiber better, especially if she's having some type of a flare? Neha, do you have some insight?
So, yeah, I can provide some insight. So one thing to remember, there's different types of fiber out there, and different types of fiber has different functions on our gut. So it really depends on what symptoms you're having coming out of a flare with trying to add back fiber. Certainly if one is having loose stools or having more gas and bloating with adding more fiber in the back back in the diet, then I would look at the portions that are coming in. There are fiber containing foods out there that are gas producing. Maybe adding back, broccoli or cauliflower wouldn't be the best bet right there. Or if you wanted to add cauliflower, I wouldn't start with like gobi Manchurian. I would start with mashed cauliflower, cooked well, maybe mixed in with a little potatoes, as an example. This is where I think it would be helpful to work with the dietitian because, again, there's so many different types of fiber out there, and different types of fiber has different functions in our gut. Depending on your tolerance and the portions that you try, it would be important to really select out like a list of fiber containing foods that you can try initially, like bananas or potatoes or yams, or even something within the South Asian diet like idlis or dosas, which is a mix of rice and dal, which can possibly help as well. But again, it's really more individualized, and it's, that's how I can probably address that.
So fiber can definitely, be a friend when you're not in a flare. If you have a mechanical stricture or a flare, you have to change the type of fiber in terms of how it's cooked to break it down, and be mindful. You don't want to eat a bushel of raw carrots or broccoli or celery. You want to change it. Here's another question.
I'll add more carrots. I will make cauliflower rice. I'll do things like that, so the particle size is small, and that I can digest it. I think that's what might work for strictures, as well as having this well-cooked, very, very tiny particles, or completely blended as well.
So that's helpful. Now, there was another question about curds. Can vegan curds like coconut curd, nut curds, help the same way as curd made with dairy?
Mm-hmm.
Neha,
I can answer that. So making curds from plant-based milks, I think that's what I'm understanding, would be perfectly fine. It would have a lower protein amount in there because it's not coming from actual dairy, but having curd made from coconut milk would be perfectly fine. Depending on the coconut milks or rice milk or almond milk, at least here in the States, we have added calcium and vitamin D to those milks. So I think it just depends on what type of milk you're using, whether it's fortified with additional nutrients to help you, gain further nourishment from that particular food. But coconut curd would be fine as well.
Okay, very good. Dr. Bhatia, there was a question from one of our audience members asking about, the anti-inflammatory versus pro-inflammatory, right? Anti-inflammatory non-veg, anti-inflammatory non-veg, meat eating. So the plant versus non-veg diet. How come people who eat meat cannot be in a flare? That's a challenging question to answer.
Okay. So let me be very scientific here. So fruits and vegetables have been shown to have, a, an association, a negative association with development of IBD. Okay. So a diet rich in fruits and vegetables is supposed to prevent a person from contracting Crohn's disease, but that does not, on the corollary, means that anybody who's a non-vegetarian will have a flare, or anyone and everyone who's consuming non-vegetarian diet will develop IBD. It has not yet been proven that consuming non-veg diet, especially the white meats like chicken, fish, or egg, can precipitate a flare. There has been no a definite evidence to say or recommend that, and I believe Neha can you know support me on that. Uh, so the same points have been there in what we call as Asian consensus, wherein group of experts met and got out with some consensus statements. So again, if my patients are comfortable eating chicken and fish or eggs, I don't tell them not to do that. Okay, does that answer your question, Dr. Nandi?
I think so. I think that helps our viewer. I hope it does. We had some great questions here today. And I think, before we close, because we want to be mindful of time, we tried to cover a couple of important key concepts of, you know, the effective diet in IBD.
Right.
Not avoiding fad diets, but looking at your own custom diet. Work with a dietitian.
Hmm.
Recognize malnourishment in yourself. Work with your clinician. Work with a dietitian. And then in your diet, as a South Asian individual, there are some wonderful tips that Neha Shah shared with us, and Dr. Bhatia and Tina, about how you can get more protein physically into your diet, how you can try to. There's different types of dairy. If that is a source of protein for you, that may not give you diarrhea from lactose intolerance, and hydration also being very important. Um, Before we close, I want to ask our guests: are there any last-minute closing comments that you guys all want to share with our audience before we go?
I think one thing that I've seen over the years, and I've been specializing in IBD for about now 15 years, both the medical side and the surgical side, is that a lot of my South Asian patients cannot have their South Asian foods. A lot of them have transitioned out of eating their own cultural foods to more what they called bland foods, more foods that they consider to be more Americanized than not. And I really want to stress, whether your cuisine is Gujarati cuisine or Bengali or Punjabi or South Indian, a lot of these South Asian foods can easily fit into a diet meant to nourish you during a flare or whether in remission with IBD. But I think it's also important to work with a dietitian who's familiar with the South Asian cuisine to help you introduce those foods back. Not all foods are equal to one another. Tolerance can vary, and we need to just to find your way of what's going to work for you. But I really want to stress that you can keep your cultural foods. We just have to be creative on how we bring that into the diet.
Okay. Tina, do you have any other closing comments that you want to share with our
Yeah,
guests?
no, I know there's a lot of questions coming through about very, very specific, types of foods. I again want to just emphasize it's very, very important to me as a patient to make sure that you all know that it's it's a good idea to try small amounts of these foods. There is no black and white. There is no yes and no for a lot of these
Yes,
foods.
yes.
It's one of those things that you simply have to try because this is very, very individualized with regards to diet. What works for me might not work for you, and what works for you might not work for me. So our bodies are different. It's a good idea
Exactly.
to try little bits. And also, something that's just really important for me to share today is that I don't like something that breaks my heart on a daily basis is that seeing over restricted diets, seeing people malnourished. I have been there. I've been there with you. And it takes such a huge toll, not just on our bodies, but on our mental health. And I have to emphasize that there are ways, like Neha said, to modify our cuisine and make it work. I don't want you to cut out wheat or dairy or soya just because someone said, oh, that's not good for IBD. No, you have to do what works for you and what works for your child. That is my key message today is this is individualized. You need to do what works for you. And the best thing to do to work with a doctor who understands the role of diet, like Dr. Bhatia and Dr. Nandi. And also, if in India or in whichever country you are in, if you can find a dietitian who you can work with who can help you reintroduce some foods, that's key. But I also just want to say very quickly that there is no replacement for medication in this disease. I have lived that. I have seen it. I have tried to do diet-only therapy, and I have landed myself in the hospital and in surgery. So please work with your doctors, work with your care team and your dietitians to make sure that your medication is optimized and your diet is optimized. Thank you.
Those are wise words. I wanted to take one more question from one of our audience members. I want you guys to know that we try to get to as many questions as possible. It's really hard.
Yeah.
But there was a good question that is somewhat related to the topic, but someone was asking about how do I differentiate between my actual flare and how do I differentiate between an infection in my gut and that their clinician may be telling them they have one or both. And then, of course, comes the challenge of diet and being on a restrictive diet. So as brief as I can be, I'm sorry that you're flaring right now. The challenge is that when you have Crohn's or colitis, think of it as a clean cut inside an ulcer in the intestine. And that ulcer is the immune system attacking the gut, and then it can become infected. So if you have a paper cut, it looks clean, but if it gets infected with like some dirt, it'll become like pussy. And so that's why we look for other infections like C. difficile or Clostridioides difficile. It's a bacterial infection of the gut. We look for other viral infections of those ulcers that you can't find necessarily in stool studies like cytomegalovirus or CMV, and rarely HSV, which is a herpes simplex virus, not the sexually transmitted kind. There's 9 different types of that virus. And then other infections that are also common, like giardiasis, cryptosporidium, protozoal, amoebic infections. So your doctor will rule those infections out and then try to use a medicine and potentially some diet to try to heal the inflammatory bowel disease. And once you heal the ulcers, that's where we see that people can tolerate different foods better. It's not that foods cause inflammation alone or directly, not most foods, we don't believe, but that if you have inflammation and swelling, it's hard for the physical digestion, the physical absorption to occur. And also if we believe that if you eat certain types of foods, it may promote some type of bacterial imbalance. Remember, all our food is digested through fermentation. How we make fine grapes into fine wine is through fermentation. And that fermentation results in gases and other substances as the bacteria and yeast digest, ferment, that get released as gas and diarrhea. We may mistake those for flare, and certainly it's part of the flare. So in a flare, when you have active disease or an infection, that's why it's harder to tolerate food. And that's why there was an appropriate question earlier. How come someone who eats meat or is plant-based, how can they tolerate or not tolerate diet? When you're healed, you can tolerate more food. And that's why the same person who asked the question about flare versus infection, the question is spot on. What can you eat and the confusion between the two? It's not that the food is causing your flare to be worse. You're trying to eat healthy. I looked at what you wrote. Once your clinician can help you get it into remission, you will feel better. You'll be able to tolerate. But that's why this talk is telling you, recognize that you're at risk for malnutrition by not consuming enough. Take our panelists' words, supplement with protein, hydration, find different sorts of nutrition. Start with a tablespoon or a half tablespoon. Try things, and we're not saying it's not going to be easy, but you may actually, by trying and increasing, tolerate a little bit more than you would otherwise and increase your protein stores. Now, with that said, I want to give the last word to our guest, Dr. Bhatia. Dr. Bhatia, anything that you'd like our South Asians, both in India and Pakistan and all over the world, to know about diet and IBD?
I want all of them to listen to you three. Your parting, your wise words were spot on. So again, once a patient is in remission, there is absolutely no reason to avoid any particular kind of food. So if you want to eat something and if you feel uncomfortable about it, there is a way to incorporate that in your diet. And I think Neha and Tina have emphasized that point, very well. But whenever you are in flare, obviously your tolerability for food will go down, as Dr. Nandi was just talking about. So that is the time you need to consult your doctor and your dietitian to come out of that, and that is the time your body needs more nutrition. So again, if I have to emphasize one thing, that there is nothing which is medically proven to cause a flare. So you can eat everything, whatever suits you. So I always ask my patients to either keep a mental food journal or a physical food journal and see what suits them best. So it is highly individualized. There is no guarantee that you go on a gluten-free diet that you will be in remission forever, or if you avoid dairy that you will not, you will never have a flare, or if you avoid non-vegetarian food that you will never have a flare. No, all those are myths. So please eat a balanced diet, and please consult your doctors and be on the lookout for malnutrition, malabsorption, and take a help of a qualified dietitian to help you out with the local foods. How can you incorporate your own cultural local foods into your diet? I think that will be all.
Very good. Thank you so much, Dr. Bhatia. Tina, thank you so much for being here. Neha, I think we somehow lost some audio, some technical glitches, but I want to thank all of you guys for taking the time across different time zones. It's really early for Neha and really late for Dr. Bhatia. Really appreciate that. Also, I want to thank our entire audience who joined us today. This is just one of many topics. So if you have more topics, more questions, we could do an hour on any of the questions that you guys asked. And we can do that. Just tell us what you want. Put them in, message us on social. You can DM me. I will eventually get back to you, I promise. And we'll take all those topics in hand. In our group here, this is part of our core group of clinicians who are dedicated to you, who really want to help our South Asian community everywhere, okay? So we can bring you more customized information. So please use us as a resource, but always remember that your clinician, right, they are the ones there for you. They're the ones who you should have tailored, direct information, recommendations from your own personal clinician. We hope that what we provide you can serve as a good resource. So thank you all. Thanks, everybody. Have a great night, a great day, great night, wherever you may be. And until next time on FitWitMD, we'll see you again. Have a great weekend.